if both the flexor carpi ulnaris and the extensor carpi ulnaris muscle were contracted simultaneously, what movements would ensue at the wrist? This kind of question can be problematic for people because oftentimes they've forgotten specific attachments and they've forgotten specific functions of these muscles. And this is where I think learning the general function of these and knowing where they cross a joint is much faster and better time spent. That will allow you to attack these questions with reasonable thought process without unreasonable time being spent on every muscle and their attachments. So what do we really have going on is we have something on the flexor side and something on the extensor side, both near the medial aspect. And if you think of the two muscles pulling and canceling their flexion and extension functions, you can actually see how they would cause adduction, which is ulnar deviation. If we divide the wrist into two halves with a flexor and extensor surface, we're going to have flexors on the anterior half and extensors on the posterior half. If we divide it again into a medial and lateral half, we have radial deviation and ulnar deviation, also known as ulnar deviation being adduction, radial deviation being AB, abduction. If the tendons cross in this first quadrant, they'll be flexors and adductors. And if they cross in the other quadrant shown here, it's flexor and abductor. Likewise on the posterior surface. Now if we put the muscles and where they cross from that previous question, you can see that the flexor carpi ulnaris and the extensor carpi ulnaris are in opposite quadrants across from one another on the ulnar side. That means that they're going to be flexors and adductors, whereas the extensor will be an extensor and an adductor. If we cancel out our flexion and extension, we can see how the summation of the remaining ulnar deviation would cause adduction.